Hello, and welcome to Public Health Live, the third Thursday breakfast broadcast. I'm Rachel Breitster, and I'll be your moderator today. Before we get started, I would like to ask that you please fill out your online evaluations at the close of today's program. Continuing education credits are available after you take our short post-test, and your feedback is helpful in planning future programs. We encourage you to let us know what topics are of interest to you and how we can best meet your needs. As for today, we will be taking your questions throughout the hour. You can call us at any time at 1-800-452-0662, or you can send written questions by fax to 518-426-0696. Additionally, you can email us at any time throughout the hour at phlive.ny@gmail.com. Today's program is iChoose600, helping people order fewer calories at fast food chains. Our guests are Theresa Cohen, the Nutrition Policy Coordinator at the Bureau of Chronic Community Disease Prevention at the New York State Department of Health, and Ann Lowenfels, a research scientist at the Bureau of Chronic Disease Evaluation and Research at the New York State Department of Health. Thank you both so much for being here. We're really excited to have this conversation today, and I think, Theresa, we're going to start with you, and if you could just introduce us to the whole idea of the iChoose campaign and just get us started with some background information.
Sure. The New York State Department of Health designed and implemented iChoose as a calorie awareness campaign to encourage consumers to use the calorie information posted on menus in fast food restaurants. We have three main objectives, and those are to increase awareness and usage of calories postings, to educate on the number of recommended calories per meal, and to decrease calorie consumption at fast food chain burger restaurants. In 2001, 1 month after the new year, when eating healthy is often at the top of most people's lists, we launched the iChoose campaign, and it ran for 6 months. And this was really in response to overweight and obesity in New York State. We were lucky enough to have federal funding through the Communities Putting Prevention to Work grant.
Great. Now, so with the whole topic of obesity and people being overweight, what made you focus your efforts around menu labeling? Where did that come from?
Well, during the past few decades, obesity and the consumption of food outside the home have increased significantly. The average American is eating out 6 days per week, and about 1/3 of their calories are actually from food prepared outside of the home. We also know that African Americans and Hispanics are more likely than the general population to eat out on a regular basis. And Americans are spending a lot more of their food budget, actually almost half, about 48% of their food dollars, on restaurant meals and food prepared outside the home. In 1970, Americans spent just about 26% of food dollars.
So clearly our trends are that we're eating out more and eating at home less. So Is there an association between eating outside of the home and gaining weight?
There is. There is an association between eating out and weight gain. Essentially, when people eat out, they eat more than when they eat at home. And adults who eat at fast food restaurants are more than twice a week gain more weight than people who don't. And unfortunately, kids are not spared the extra calories when they eat out either. Kids eat almost twice as many calories when they eat out as compared to when they eat at home.
So this is for adults or children. We're looking at weight gain when eating at restaurants. And so why is that? What is it that's specifically causing the weight gain when eating at restaurants?
Well, restaurant food is generally higher in calories than food that's prepared at home. And serving sizes are much larger now and have increased over time. What was once a medium or large is a small now. Foods are offered in combo meals at good prices, so a little more money gets you a lot more food, and essentially people want their money's worth.
Sure.
And when we are served more, we eat more.
Absolutely. I know that's true with me. And when you go out and you've got the whole portion, you would never eat that much at home, but when it's sitting in front of you, it's good food. You keep eating. So is there state or federal legislation that requires calorie posting to be available?
Yes, at the federal level, the menu labeling provision of the Affordable Care Act of 2012 requires that chain restaurants with more than 20 outlets nationally post calories on their menus and menu boards. And they actually need to post these calories at the same size and font as the prices on the menu board, so they can't be smaller or off to the side. They're also required to provide a statement about 2,000 calories as the daily calorie consumption per day. And while this menu labeling provision has been proposed and went through a comment period, it hasn't been finalized yet. But New York State was considering a menu labeling law when the Affordable Care Act of 2010 was passed. There are 5 counties in New York State and New York City, though, that do have local menu labeling laws, and New York City and 4 of the 5 counties are actually enforcing those menu labeling laws.
So in places where there are these menu labels, how does a consumer know what to do with that information?
Well, as I mentioned, the menu labeling law is there so that calories are posted so that consumers can make an informed choice. But without a point of reference for calorie consumption, calorie postings really can have very little impact. So there needs to be that educational piece. And our formative research showed that people need a framework for calories. So is 1,000 calories a lot or a little for a meal? And so the iChoose campaign provided this educational component. One other thing I just wanted to mention about that slide that was just up, it shows the combo meals that I mentioned before. And it's really a good example of showing you that you can have a hamburger, or for less than $2, you can have the combo meal. So right there is that example of
encouraging.
Getting a lot more food for just a little more money, and people get their money's worth that way.
Okay. So certainly this is an important message for everyone. I mean, it's good for all of us to be aware of calorie information and what our daily intake should be, but was there a particular demographic that you were targeting with these messages?
Yes, early on we identified this priority audience for the media campaign, and they are lower income minority women aged 25 to 44 with younger children. And we chose this population because they're at greater risk of obesity, they're more likely to consume fast food, and we chose mothers because moms are often the gatekeepers and decision makers for the family, especially for younger children. And targeting women with children provides an opportunity to potentially make a long-term impact on children too.
Sure. Was there research available to help you, target that particular audience?
Yes, we did an internet survey and conducted 4 focus groups. And we worked with a communication agency, Zone 5, to do this. They recruited participants for the focus groups, and the participants were right within our demographics: mothers aged 25 to 44 living in lower income communities. And we ended up getting more than 50% African American and Hispanics. And these participants frequented fast food restaurants at least 4 times a month. And all of this work really was done with Nicole Levy from our public affairs group.
Okay, and we actually had the opportunity to speak with Nicole Levy at the Department of Health about some of the work that went into that marketing campaign. Let's take a moment now to hear from her about this experience.
There were a few things that we needed to do even before we could get into actually designing an ad. We had to make sure that we understood the target audience and how they go about making decisions when it comes to eating out. We needed to understand what was happening in the marketplace around menu labeling and looking at what other people had done to date. Does it work? Does it not work? And why? And then we also had to look at the restaurant industry and see what they were doing and build off of their knowledge as well. Ad placements are chosen based on the target audience's media footprint. So we look at what they're doing in an average day, a week, even over the course of a month. We need to understand and target where they're consuming media. So when we test the messages, we actually go into focus groups and we have participants made up of our target audience, and we ask them about the creative and whether or not they can relate to it, what they think of it, is it something that they would positively react to, and even what do they think about the messages. We need to make sure that it's something that they can identify with. And based on those responses and what we know of their media consumption patterns, we were able to buy and secure media placements within each county.
So it certainly seems like a lot of work went into making this happen, knowing who your audience was and how to effectively reach that audience. What did you learn from the formative research that was done?
Well, as Nicole said, we wanted to determine the key messages that resonated with our audience. So we had 350 online surveys completed, and one of the findings from the surveys was that children have a strong influence on where the families eat out. And they're more likely to choose a chain restaurant over an independent restaurant. Mm-hmm. From the focus groups, we found that 2,000 calories a day was not an actionable message. Majority of the target audience was not aware of the recommended 2,000 calories per day, and they were also then unclear about how you would break that down into calories per meal.
Okay.
The audience, though, was receptive to an order less message. Focus group participants acknowledged that they didn't go to fast food restaurants to eat healthy. One woman said if she wanted an apple, she would go to an orchard. And they didn't want to see messaging about choosing salads and yogurts. So they were, receptive then to this choose less message.
Okay. So you worked with them to hear about what would they be receptive to hearing about, and then from there you were able to develop your marketing materials?
Yeah, so we used the formative research to develop the messages and the marketing materials, and we chose that, we went with the choose meals under 600 calories, since this was an actionable message. Mm-hmm. We chose to focus on chain fast food restaurants, and specifically burger restaurants where we know that women with children are eating, and this also kept our messages simpler. Focus group participants said that they didn't want a health authority telling them what to do, so we created messagings, kind of the peer-to-peer communication, like women talking to other women about how they decrease calorie consumption through using calorie postings. What was interesting, though, was they did think that we should have our name. They should have Department of Health on the creative, or else they might think that it was a fast food chain advertisement.
Interesting.
Yep. And we also decided to focus the messages on choosing less, since many said that they were not willing to make big changes. They weren't going to have a salad, but they would choose less and less calories. And lastly, their kids motivated them to be healthy. So we use messaging around being healthy for your children.
Okay. So with the whole idea of choosing 600, where did that 600 number come from? I mean, I know you've said 2,000 calories isn't actionable, but where did the 600 come from?
Well, as I mentioned, the focus group participants prefer that per calorie message over the per day calories versus the per meal calories versus the daily calorie consumption. Right. So we went with that messaging. And the recommendation for the average adult is 2,000 calories a day.
Okay.
And that was the base for our calculations. So we arrived at 600 calories for 3 meals a day, including 2 snacks at 100 calories each. Of course, some people may eat more at lunch or dinner.
Sure.
Some people don't have snacks. And people probably don't even eat 600 calories for breakfast unless you're at a fast food restaurant. It's often hard to get a meal, a breakfast meal for under 600 calories. But we decided that 600 calories really was a good target, really for anyone, regardless of their calorie target for the day, and especially good for people when you're eating at fast food restaurants.
So I have to say, I'm not a big frequenter of fast food restaurants, but just in what I've heard or what I gather, is it realistic to say that you can order a meal for 600 calories at a fast food restaurant?
Believe it or not, it is. And actually, a lot of the focus group participants, when they saw the picture of our creative of the woman eating the burger, a lot of them said, you can't have a burger for under 600 calories, but really you can.
Okay.
And what you'll see on the slide is some very popular burgers at a fast food restaurant. And to be honest, not all of them fall under 600 calories. There is a range. A lot of those burgers do have more than 1,000 calories. But some of the more popular items, for example, a Big Mac, has 540 calories. So if that's all you're eating, it does fit under the 600 calories per day. Something like a quarter pounder with cheese also, that's 510 calories.
Okay.
And even the premium crispy chicken classic sandwich, which I believe is fried, is 530 calories. But some good examples, though, of actual meals, if someone's interested in getting, say, French fries, a basic cheeseburger with small fries and a water is about 530 calories. And a good example right there is that someone chose water versus a sugary beverage.
Sure.
So that's how you can keep it under 600 calories. And of course, these totals for calories are dependent on the fast food restaurant that you're eating at. Another good example is a grilled chicken sandwich and a small iced coffee. A lot of people are drinking iced coffees, and this totaled about 560 calories. And just some other quick examples, a salad with low-fat dressing, and I emphasize the low-fat dressing does fit under 600 calories per meal. And even one of our bloggers said you feel full after eating one of these meals.
Okay, that's great to hear. So this is a pretty big campaign with a pretty big goal. What were some of the key messages that you really wanted to get across?
Well, first of all, we didn't want this campaign to be an endorsement of fast food. Fast food is usually high in fat and sodium and calories, low in fiber and fruits and vegetables. But the reality is that people are eating at fast food restaurants. So our primary message was to choose meals under 600 calories. We also wanted people to recognize that they could decrease their calories and they could accomplish these in very small, easy changes. And so we had secondary messages that we depict on our brochures, in presentations done by the counties, and also on our Facebook page. And those are messages like choosing water instead of soda, ordering a small fry instead of a large one, or sharing them with a friend, limiting mayonnaise and cheese and sauces because they often add calories, ordering individual items instead of the combo meals, avoiding burgers with bacon and kind of the extra patties, and also going for grilled, not fried items.
Okay. And what were the different campaign components that you used to try to get these messages across to people?
Well, we contracted with the 4 counties in New York State that are enforcing menu labeling laws. And we basically were looking for them to bring more attention to the campaign. And then the media campaign components consisted of an iChoose600 Facebook page, and we had media placements in all of the 4 counties that we were working in. The creative, which we started referring to as the Happy Burger Lady, that creative was at mall food courts, billboards, we had transit ads, so bus shelters and bus wraps, and then we had flyers and brochures in a number of different doctors' offices.
Great. Now, one of the things you mentioned was the Facebook page, and so I'm curious, I feel recently we hear more and more about the use of social media in public health. So can you tell us a little bit about how social media was used in your campaign? Sure,
and this was really the first time that I had a chance to work with a Facebook page for a project. And focus group participants said that they would visit any type of website or page if it was noted on the creative. So we knew that this was a way to reach out to our audience, to get the message out and to engage them. So the Facebook page had daily posts, and a lot of them were about our secondary messaging, about skipping mayonnaise because it adds a whopping 40 calories to your meal. We did Facebook contests and quizzes to engage the fans in the beginning. We had Facebook ads and banner ads, and we also had a fast food calorie counter. And this really was done by our public affairs group, and they also reached out to food and mommy bloggers to start talking about the campaign and to test the messages out. So in doing all that, because it certainly sounds like you had a lot going on your Facebook page, which is great, how did you develop and manage that page? We actually hired a marketing agency called Likeable Media to develop and manage the page. And our public affairs person, Nicole Levy, who you heard from before, she actually worked with them on this piece. Okay, excellent. And as you just said, Nicole was very involved in the creation of the Facebook page for this program. We had the opportunity to speak with Nicole and hear about her part of the process in creating the Facebook page. So let's take a moment now to hear from Nicole about her experience working with Facebook.
The internet ads were so helpful in driving large numbers of traffic to the Facebook page. We placed them on a lot of mommy sites. We used Facebook because the target audience was on Facebook, and they were looking for an environment where they could communicate with other moms and have that peer-to-peer communication. And Facebook for this campaign was worth its weight in gold. We were able to get in front of them on a daily basis with posts and contests, give them a calorie counter application that they could use, and really reinforce the messages that we needed them to understand on a daily basis. There was one thing that really did surprise us when it came to the interactions of the fans on the Facebook page. Prior to launching the campaign, we were really ready for that big brother pushback in that here's another government entity telling us what we can do, what we can and cannot eat. And the iChoose600 campaign doesn't do that, and there wasn't that big brother pushback, and it was just the opposite. In the end, they were asking for more and more from us in a positive way. And it also allowed us to have an opportunity to hear from them what they were thinking and give them what they needed versus waiting until the campaign ended and going through evaluation and hearing about things that didn't work when it was a little bit too late.
So again, certainly a lot of work going into it, but it seems like it really paid off. Tell us a little bit more about, you mentioned with the Facebook having banner ads. Can you talk to us a little bit more about some of that?
Sure, Nicole talked about it a little bit, so I'll just mention that we used our Facebook ads and banner ads to drive traffic to the iChoose Facebook page. The Facebook ads appeared on basically our primary audience's pages. So if you're familiar with Facebook, along the right-hand side, there's usually advertisements, and it's really based on your demographics. So if you fell within our primary audience, you might have seen a Facebook ad on your Facebook page, and if you clicked on it, it brought you to our page. We also had banner ads out on the internet on other websites, and again, this was where our primary audience visits. And what was interesting about these ads is that the food ads did a lot better than the other ads. So if there was a picture of food on the screen, there was an example of one that had some, I think there were some chicken wraps, and the other one was a picture of a child. And actually the one with the food did better.
Interesting.
Very interesting. And also we had ads that asked people to like us, and those did really well too. They were one of the best ads.
And I think actually on my own personal Facebook, I think I've seen the iChoose on my right column, and I think, oh, I know about that. So can you tell me more also about the calorie counter that you mentioned?
Yeah, the calorie counter application was created to really to support consumers in choosing meals under 600 calories and to assist them with actually creating a healthier meal before they go to a fast food restaurant. Focus group participants, when they said that the pace of a fast food restaurant is too quick, they needed something kind of prior to walking in the door, because when they got in line, they felt rushed to place their order. So when you were on our page, if you clicked on the calorie counter, you could choose one of the 4 fast food restaurants that we had targeted, one of the burger restaurants. And from there, you could select food items, and it would total it up until you were either at 600 calories or more, and you could add and subtract. Unfortunately, the calorie counter was not used that much because on the Facebook page it took a long time to load. And the other thing was people couldn't use it on their smartphones. So there's a place that we would really like to improve so that this application is out there for people to use.
Sure. Well, also at least some lessons learned, right? Things that worked really well, things that can be improved upon for other states or counties looking to do similar initiatives.
Yeah, and if we have future funding,
sure, which would be great.
Yep.
Now, I know during the campaign, I had seen the iChoose messages on billboards throughout the county, but where else did people see these messages?
Well, I'm glad to hear that you saw the billboards. All of our media was placed in the 4 counties that we were working with, primarily in the lower income communities. So those billboards weren't highway billboards, they were really within the communities. In addition to the billboards, we had transit ads, so bus shelters, bus wraps. In the larger malls, we had creatives. They actually printed them for the walls, for mall directories. And here in the Capital Region, one of the malls had escalator wraps. So they were right along the side of the escalator. So as you rode up or down, you could read the messages. And this was the first time I had actually seen one of those. Yeah. They also had them to the entrance to the mall building. And tabletop ads and banners were in the food courts. And the tabletop ads were great. I mean, you sat down to eat a meal and it was right there.
Right in front of you.
Yeah,
You can't
those were
avoid
wonderful. And so they were So we had a lot of media placed throughout the 4 counties, and we got a lot of great feedback from people. We heard a lot about, oh, I saw it or heard it, or so it was great.
Excellent. Now, the 4 counties that you've mentioned you worked with, how were they involved in this process?
Each of the 4 counties, the county health departments actually received a small grant to draw attention to our media campaign, and they conducted presentations, garnered earned media, and also distributed brochures throughout the community.
Excellent. Now, one of the counties that you worked with was Albany County, which, right here, this is where I live, and we had the opportunity prior to this broadcast to meet with a representative from the Albany County Department of Health to hear about their experience and the campaign that they did and the materials that they used. So let's take a moment now to hear from Charles Welge about this process.
It's important to recognize that education on an individual basis to be effective needs to be complemented with system and environmental changes. So the extent that we implemented a policy in Albany County Department of Health on menu labeling is effectively influential on behavior if it is complemented with interaction on the media side, but also with individual interaction. Our outreach efforts were pretty comprehensive. The Albany County Department of Health had established a menu labeling law, and it's important for the public to understand what calorie counts mean. And so we engaged the public in terms of public presentations, earned media, and also involvement in distributing materials to work sites and other community events. People were very receptive to the iChoose600 messages. The State Health Department's campaign of billboards and placards was very well recognized, and so people were curious about iChoose600 when we approached them with presentations. Here are some of the testimonials that the public provided to us. Many felt they could make lower calorie choices, but they wouldn't give up their fries. Another said that she was more aware of what food she fed her children. Others indicated that they never noticed until now the numbers before on the menu, and they're going to start making more notice and choices accordingly. We engaged earned media in a variety of ways. The State Health Department sponsored a kickoff campaign during Public Health Week at a local mall. During Earth Day, we worked with the City of Albany to conduct a bike parade with local transit placard kind of launching the event. We still continue to actively use and engage the iChoose600 campaign. The icon for iChoose600 is on our website and is a link to a variety of nutritional resources. We work with primary care offices to provide them with DVDs and educational materials to inform their patients. And we also provide at community events a variety of interactive iChoose600 resources.
I find it really interesting to hear about all of the different ways that the county gets involved, especially hearing from my own county. In addition to the things that the counties are doing, did any local food companies express any interest in participating in the campaign?
Yes, we had several companies that were actually interested in using the creative. On the slide, you'll see an example of a local sandwich shop, Mr. Sub, who actually started using the creative in their ads. They also posted the calorie message on their signboard. But at this time, this is when we realized that we probably wanted to trademark iChoose, so that it wasn't really being used to promote something that we weren't promoting, something outside of our campaign messages.
And that certainly makes sense. Now,
Right.
You've done so much work with this campaign. What's next for iChoose?
Well, the Facebook page is still active, and we have 5-week posts going on currently, and that's done by the Public Affairs Group. And we also have our iChoose materials that can be downloaded from the New York State Department of Health website. And of course, we're going to continue to support the federal legislation, and hopefully there'll be future funding and we can continue to do more.
That would be terrific, because certainly it seems like so much work has gone into this, and it, at least from my standpoint, has been so effective. When I talked about this broadcast with friends, very many people were acquainted with, oh, the iChoose, I've seen the bus ad, I've seen the billboard, so I certainly hope that it does continue.
Yeah, it was very successful.
Excellent, and thank you so much for sharing all of the information with us. Now, finally, we'll get a chance to talk to you a little bit, Anne. So in looking at what we've talked about so far, we have an idea of what the whole iChoose campaign has been. I'd like to hear from you today about some of the evaluation aspect of this campaign. So would you start by just telling us what are some of the evaluation topics you're going to cover, and just get us started on that topic?
Sure. Yeah, I think I'll start by giving you a little background information
Sure.
about, just so you have a sense of what's already known about calorie labels and how effective they are.
Mm-hmm.
And then I'll talk a little bit about the methods that we use to evaluate this particular project. I'm going to describe some of the data that we got when we did a baseline assessment before the media campaign was even conducted. And then I'll give you a little information about the data we collected after the media campaign was conducted. And finally, I'll tell you what happened when we compared those two data sets.
Great. So what is already known about the effectiveness of calorie labeling?
Well, the New York City was out front with their calorie labeling requirement. That was 2008 that they started. And then soon in 2009, King County, which is in Washington State, they also started requiring labels. Both of those requirements were thoroughly evaluated for the effectiveness to get a sense of what impact those calorie labeling requirements had. So that data has shown us that there is an association between calorie labeling and calorie awareness, and that there's an association between self-reported use of labels and between and purchasing fewer calories. There's also an association between calorie labels and purchasing behavior for some customers and in some restaurant chains. So we wanted to find out whether the calorie labels were effective when they were combined with a media campaign like iChoose.
Okay.
And so we already knew a lot about whether calorie labels alone were effective, but we wanted to know about how effective they were in combination with a media campaign like that.
And so how did you evaluate the effectiveness of the calorie awareness campaign?
Well, to evaluate the campaign, we surveyed customers before the campaign, the media campaign, and after it. And remember, the media campaign that you just heard about encouraged customers to notice and to use the calorie labels. But the confusing thing for this evaluation project is that the counties were posting labels at different rates.
Right.
So some counties actually had posted labels and others hadn't when we started the project. So actually, if you want to have a look at the map there on the screen, we'll see that 3 of the counties in the study started requiring labels before our evaluation even began, and they're on the right there. That's Schenectady, Albany, and Ulster. And then 1 county started requiring labels after the evaluation began, and that's Suffolk on the bottom. And finally, there's a county that never required labels that was involved in the study, and that's the one that's highlighted in blue. And that was kind of a control group for the project. So if you look also on the bottom, you'll see New York City is highlighted. They did require calorie labeling throughout our entire project, but they were evaluated separately, as I mentioned before. And so their data is not included in the results that I'll be showing you later today.
Okay. So where were the restaurants, or where were the customers of these restaurants? Where were they surveyed, and how did you identify the locations where you were actually going to speak with the customers?
Well, to align with the media campaign, we surveyed customers in front of popular fast food chains. And on the screen, you'll see the logos from the 4 fast food chains that were involved in the study. We started with a complete list of the fast food chains in the 5 counties that I just mentioned, and there were 185 of them. So we didn't survey in front of all of them. We visited about 60, and we met with the site managers, and ultimately we selected 30 restaurant sites to include in the study. And we went to those sites before the media campaign to survey customers, and we went back to the same sites again after the media campaign to resurvey different customers.
Okay. And so when you went out to those different restaurants in these various counties, what kinds of things were you asking the customers?
Well, I just wanted to stop and let you know that the evaluation data was collected by the Center for Human Services Research, which is affiliated with the University at Albany. And they hired and trained a team of data collectors. And actually, if you look you'll see on the screen in just a minute, there's a photo of the data collection happening at one of the fast food chains in the counties. And so the data collectors had a one-page survey that they asked the customers on their way out of the restaurant. You'll see that's depicted on your screen on the right there. And a couple of questions that I wanted to point out that are on the survey there are, can you tell me what you ordered for yourself today? Did you see calorie information in the restaurant? Did you use calorie information to help you decide what to buy today? And we also, after the media campaign, we also added a few questions to see if the customers had noticed the iChoose ads anywhere. So it's another interesting thing about this study is that the data collectors actually collected customer receipts from individual customers, and then they downloaded the calorie information from the restaurant websites and calculated calorie totals for each of the customers that was surveyed. So that's really an unusual feature, and some other the study in New York City and in Washington County had done something similar, so we were able to kind of follow their methodology there.
So is that sort of like a quality check to make sure that what people are reporting lines up? Is that?
Exactly, yeah.
That's excellent. So when you went through all of those processes, what did you learn from the baseline data that was collected?
Well, we learned that fast food customers eat a lot of calories. And so at least that we learned that they ordered a lot of calories. And we surveyed over 1,000 customers before the media campaign was even conducted. Remember, this is just our baseline data that we're talking about now. And the average calorie total for these customers was 923, which is well over the 600 that Theresa was talking about for the media campaign. And you can get a sense from the baseline data how much we needed this kind of a media campaign. So that was an average. 923 was an average, meaning some customers ordered more than that and some ordered less. And the real interesting thing is to find out who orders less. And so we found that customers that said they used calorie information, they ordered less. And customers that used specific ordering strategies, they also ordered less. And I'll be talking a little bit more about that soon.
Okay. And what did you find, how important is it for customers to use calorie information?
We found out that it was very important for customers to use calorie information, and I have some graphs that I'm going to show you. If you look on the left of this first graph here, you'll see that you'll see the calorie totals for the customers that said they always or sometimes or never used calorie information in a general way. The question was worded generally. Here, I'll read it. When deciding what foods to buy from food stores and restaurants, how often do you consider calories? So you can see that the calorie totals were significantly lower for the customers that said that they always use calorie information on the left side of the graph there. On the right side of the graph, you'll see the calorie totals for the customers that said they used or did not use calorie information today. So this is a specific question. And we worded it in such a way that it could be used in any county, whether there were calorie labels posted or not. Here, I'm going to read you that question too. Did you use calorie information to help you decide what to buy today? So the calorie totals were significantly lower for the customers that said they used calorie information today, which is that was depicted in gray on your screen there.
Sure. And just a reminder to our viewers, if any of the graphs are difficult to see on your screen, all of the materials in today's webcast are available as handouts on our website, so they can be printed out as PDFs as well, because you've got a lot of great information in these charts here, and we want to make sure everybody can see them.
Sure.
Now you mentioned purchasing strategies that customers used. Can you talk to us about what you mean by purchasing strategies?
Sure, yes. We identified 3 specific strategies that were used by customers who ordered fewer calories. So you'll see on the graph that, and just to explain, the calorie totals for the customers who used the 3 specific strategies are depicted in blue, and the calorie totals for the customers who did not use those strategies are depicted in gray. And so you see this big gap. And so what are the strategies? Well, moving from left to right, the customers who purchased low-cal or no beverage ordered fewer calories than the customers who did not. And in the middle, you'll see customers who ordered small or no fries ordered fewer calories than other customers. And finally, on the right, you'll see the customers who ordered fewer than 3 items also ordered fewer calories than other customers. And this is, remember, this is even before the media campaign was conducted. So this is just, some people walk into a fast food restaurant with these kinds of strategies in mind, and that it makes a big difference in the total amount of calories that they purchase.
Yeah, I mean, looking at those graphs, I mean, that is a very drastic difference for the folks who are using a strategy versus those who aren't. Mm-hmm. Now, are those the only strategies that customers used, or were there others that you found as well?
Well, this was a receipt study, so we only measured the calories that the customers purchased. and we were not able to measure calories that the customers actually consumed. So there may have been additional strategies that customers utilized, some of which Theresa mentioned when she was describing her messages for the campaign. And they're listed, I've got a list of those that are going to come up in just a minute on the screen. Those are the kinds of strategies that we were not able to measure with this particular methodology.
Okay. And so what else, was there anything else that you learned from the baseline data that you collected? I mean, certainly you've already shared a lot, but were there other things that you learned as well?
Well, yes, I wanted to emphasize something that Theresa mentioned earlier, and that we learned that a small burger and a fry, which can be less than 600 calories, is not always. And that ended up mattering a lot in terms of the calorie totals that customers ordered. So in our study sample, we had 4 burger chains, and that you'd think they'd be similar, but that in one of the burger chains, a small burger with fries contained as little as 480 calories, but in another restaurant chain, the same thing, walking in and saying the same thing, I'd like a small burger with the small fries, that could be as much as 1,100 calories, all within those same 4 chains. So we see that gives us a sense of what a big difference the restaurant chains themselves can make in terms of the overall calorie total for the customers. And it creates the opportunity for restaurants to reformulate their menus and to make it easier for customers to order lower calorie totals.
Sure. And that, I mean, I think that's such important information, because if you get it in your head, oh, well, a burger and fries can be this many calories, and you start to think about that number, then you go into the next restaurant ordering the same thing, expecting it to be the same. And so for consumers to be aware that there can be this really big difference depending on what restaurant you're in, I find that very fascinating.
Right, and you're talking about somebody who maybe used all 3 of those ordering strategies. So they ordered no beverage or a low-cal beverage, they ordered small fries, they ordered fewer than 3 items, but still 1,100 calories in one of the restaurant chains. So portion size is really what it boils down to.
Okay. Yeah. So a lot of information gathered from the baseline data. What about the follow-up data that you collected?
Well, after the media campaign was conducted, we surveyed another 1,000 calories, same restaurant sites, and this time we asked them if they had seen the iChoose campaign, and if so, where. And we found that ad recall was higher among members of the priority audience, and that billboards and buses were the most widely seen locations for the iChoose ads, and that customers who recalled ads were more likely to see and use posted calorie labels.
Great. Now, Theresa had talked earlier about the target audience, and did you find that the target audience that you initially identified, they were likely to have seen the iChoose campaign?
Yes, we did find that. About 50% of the surveyed customers recalled seeing the ads, but the recall was even higher among members of each priority audience subgroup. And I see the graphs up there for your viewers. It depicts 4 different demographic characteristics on that particular graph, and for each section, the blue bar represents the priority audience subgroup, and the gray bar represents everyone else. So starting on the left, you'll see with age that the younger customers were more likely to recall seeing the ads. And then if you move over to the next set of bars, you'll see females were slightly more likely to recall seeing the ad. And moving over towards the right with race, you'll see the non-whites were significantly more likely to recall seeing the ads. And finally, on the far right, you'll see that customers with less than a college education were more likely to recall seeing the ads. So those were the 4 demographic subgroups that represented the campaign's priority audience, which was described earlier by Theresa. And you can see that all the efforts that her campaign went to identify a target audience and to tailor their messages to meet the locations of the target audience, all of that really did pay off, because we got a good hit there.
Which is great to see. I mean, because all of the discussion that we had preparing for this broadcast and what we've learned from you today, but all of the work that went into really making this effective. I mean, and then you show those numbers, it's clear that you really reached the priority audience that you were looking to reach. So where did people tend to recall seeing the iChoose ads? What did you find were the highest places of recall?
Right. Well, the customers that said the 50% of the customers that said they saw the campaign, we asked them where they had seen it, and their answers are listed right there on the screen for you. But just over half remembered seeing it on billboards, and 35% remembered seeing buses, and then the malls 21%, and online we had an 18% recall. And this type of information is very helpful when you think about planning another media campaign, because you
Sure.
have a sense of where really you should, target
Target.
and where people are most likely to remember seeing the campaigns.
And so did you find that those folks who were more likely to recall having seen the ads, were they then also more likely to use or to see the posted calorie labels?
Yes, particularly among the young customers, which was the largest priority subgroup that we were able to study. And if there's another graph I wanted to show your audience, that if you look at the blue bars, you're going to see the 15 to 45-year-olds who recalled seeing the iChoose ads. And if you look at the gray bars, you'll see the 15 to 45-year-olds who did not recall the ads. And you'll see in both cases the blue bars are higher than their corresponding gray bars. And that's just to indicate that the customers who recalled seeing the iChoose ads were more likely to notice the posted calorie labels, which is on the left, and they were more likely to use the posted calorie labels, which is on the right. And this is important because that's a primary goal of the campaign. And I do want to emphasize that we can't say for sure whether this is a causal relationship, but we do see a very strong association between the media campaign, recalling the media campaign, and noticing and using the calorie labels.
Which is really terrific. So when you look at all of the information you gathered from the baseline and then the follow-up, what sorts of things did you find when you were doing comparisons?
Right. Okay. Well, remember we surveyed 1,000 customers, just over 1,000 customers before the media campaign, and another 1,000 after the media campaign. And then the confusing thing is that some of the customers were surveyed in counties with labels,
Right.
and others were surveyed in counties without labels. So when we combined all their survey responses and compared the baseline and follow-up information, we learned that customers who were exposed to calorie labels and the media campaign were more likely to notice and use calorie information than the customers who were not.
So in general, would you say were customers more likely to see the calorie information, to be aware of it being posted at the follow-up?
Yes, they were, especially in the 4 counties with the calorie labels and the media campaign. So remember, we worded the question carefully so that we could use it in all 5 counties. And I've got a graph that I'm going to show you that if you look on the left there, you'll see there's a small increase in the percent of customers who saw calorie information when you compare baseline to follow-up. And that makes sense because those are the counties that started requiring the labels before our evaluation began. In the middle, you'll see a large increase in the percent of customers who saw calorie information when you compare baseline with follow-up, and that makes sense because that's the county that started requiring the labels after our evaluation began.
Sure.
And finally, on the right, you'll see a large decrease in the percent of customers who saw calorie information, and that's the county that never required labels at all. No media campaign, no labels, control county.
Okay. So that's looking at folks who said they saw the calorie labels. Now, did you gather information about differences in people that actually used the calorie labels?
Right. So we have a self-report on whether they say they used calorie information in the restaurant today. And customers were more likely to use calorie information at follow-up than they had been at baseline. And this also was worded carefully so we could use it anywhere. And the graph in front of you compares baseline with follow-up. And on the left, you'll see a small increase in the percent of customers who used calorie information. And that makes sense. Those are the counties that started requiring the labels before our evaluation even began. In the middle, you'll see the larger increase in the percent of customers who used calorie information. And that's the county that started requiring labels after our evaluation began. And finally, on the right, the smallest increase in the percent of customers who used calorie information, and that's the control county there.
Excellent.
So I do want to say something, though, that although the use of calorie information did increase everywhere, which is important because I showed you earlier that use of calorie information actually predicts ordering fewer calories.
Right.
That's very important. But overall, the percent of customers who used calorie information was very low. The graph had, those bars were very small. And it's important to keep in mind that that's really where the work needs to be done. Because if we can it's one thing for people to see the calorie information, but it's another thing for them to use it.
Yeah, I think that's certainly a very important message, so thank you for making that point. Now, with all of the work that's been done, because certainly what you've described in terms of the baseline data collection, the evaluation, the comparison, a lot of work has gone into this campaign that seems very functional and a very practical way for people to make changes to their diet. So where do we go from here? What's the next steps?
Well, based on the data that I just presented, it's clear that we should be encouraging customers to use specific ordering strategies. And we should promote generalized calorie awareness as a social norm, because these factors are proven to be associated with ordering fewer calories. So other things we can do include increasing demand for lower calorie options in restaurants, because if the restaurants reformulate their menus, it'll be easier for customers to order fewer calories. And finally, we're going to work on supporting implementation of the Affordable Care Act regulations and helping customers to understand and use posted calorie labels, because with support from media campaigns like iChoose, calorie labels may help change customer behavior in fast food restaurants.
Excellent. So you guys have presented so much information today. I've really enjoyed having you both here. If viewers want to learn more about this project, if they want to, duplicate or just learn about what's worked, what hasn't, are there people who they could contact who would be willing to share more information with them?
Absolutely. They could email myself, they could email Theresa. Both of our email addresses are posted on the screen, and there's a whole team of players at the Department of Health here in New York that'd be happy to answer questions, and they can email any of us.
Great. Thank you so much for your willingness to share and to help others who are interested in this as well. I know we've got a few questions that have come in from the audience, so we have a few minutes to go over those. So the first question that I have is that the campaign colors look a lot like McDonald's colors. Was that intentional?
Yes, actually it was intentional. As I talked about, our priority audience are more likely to consume fast food. Children tend to choose a fast food restaurant over an independent restaurant. And we were trying to, use messages that were, choosing meals under 600 calories at these types of restaurants. So we wanted our ads to look somewhat like a fast food restaurant advertisement. I think I had mentioned earlier that someone said, I would think that this ad was for a fast food restaurant if it didn't have New York State Department of Health written on it. So yes, that was intentional.
Okay. And then the next question that I have here is, did you have to receive permission from the restaurants to collect the customer data? You had mentioned that you were with these, I think it was 4 different restaurants throughout the counties. Can you talk a little bit about how you worked with the restaurants and what level of permission you needed?
Sure. Well, again, I want to emphasize that the data was collected by the Center for Human Services Research at SUNY Albany, and they went and visited each restaurant site personally and asked for permission. Other studies, like the one that was done, similar study in New York City, they didn't need to get permission because they were able to collect data on a sidewalk. But the sites here in the counties that we were in were more rural, and so they actually had to stand on restaurant property, like in the parking lot or by the doorway. And the reaction from the site restaurant managers varied, but many were very supportive and actually were concerned about the issue of obesity and felt on board with the entire concept. If to the extent that managers were not supportive and didn't want us there, it was usually concern around liability and just being in trouble from their corporate office, those kinds of things. But we really had a lot of interest in the topic.
That's interesting to hear, because it kind of, at least for me, it gives me hope that if the restaurant managers are on board with you collecting the data, then maybe they would be on board with, looking at, okay, at one restaurant we could get 480 calories, the other's 1,100. Maybe that indicates that restaurants would be willing to start looking at how they prepare foods, that we could increase the number of lower calorie options that are available. Maybe I'm an idealist, but to me that's hopeful that they were supportive of your efforts to collect the data.
Right, and we saw even some of the restaurants had their own promotions going. I think Burger King had one, trying to get people to order or give ideas for people that want to order under 650, and we noticed placemats and things. So I think the restaurant industry is on board to some degree, and we just need to all pull together and try to move this forward as best we can.
Great.
And I think Ann made a good point that I didn't mention. There are a lot of restaurants now that have a section on their menus that are, there's a range. It's 500 calories, 550, some do 600 or 650, but more and more restaurants are doing it now.
Which is really, I think it's terrific.
Yeah, it's a great response to the menu labeling law.
So we have time for one more question. And this is, have any restaurants made changes to their food because they had to post the calories?
Yeah, and I think that's kind of what we were speaking to.
Right, and that's actually a very interesting and somewhat complicated question in which we're trying to figure out ourselves. Like looking over time, are burgers shrinking so that restaurateurs can say, oh, it's only 650 this burger instead of 670, or is the default option in a combo meal now going to include a diet beverage so that again you can post then the calorie total looks lower. So that's a pretty challenging question to answer, and we are working on trying to figure that out. And it is likely that there is menu reformulation happening behind the scenes.
Sure, that makes sense.
Yeah, and one example that I can give is I know that Bruegger's, for a while, I don't know if they're still doing it, were offering the skinny bagel. And actually it was just their bagel and they actually cut off some of it.
Oh, interesting.
Right, so, and that fell under one of their menus that was like a 600 calorie or less portion of their menu.
Okay,
Yeah.
Great, thank you for that. So thank you guys both for being here with us today. I think that we've covered quite a bit of information, and I really appreciate your time and everything you've shared, both with me and with our viewers. So thank you.
Thank you for having us.
Yeah.
And thank you very much for joining us today. Please remember to fill out your evaluations online. Your feedback is always helpful to the development of our programs, and continuing education credits are available. To obtain nurse continuing education hours, CME and CHES credits, learners must visit www.phlive.org and complete an evaluation and the post-test for today's offering. Additional information on upcoming broadcasts and relevant public health topics can also be found on our Facebook page. Please don't forget to like us on Facebook to stay up to date. And as a reminder, you can also download the companion guide to this broadcast on our website, phlive.org. The companion guide will provide you with learning activities to help further your knowledge and understanding of topics covered in today's program. This webcast will be available on demand on our website within 2 weeks, and DVDs of any of our Public Health Live broadcasts can be ordered from our website as well. Please join us for our next broadcast on June 20th as we visit the topic of ethics in public health. I'm Rachel Breidster. Thank you so much for joining us on Public Health Live.